Hi, my name's Claire. Welcome to this class that's going to go through the exercises that the NHS provide and recommend that you do following breast cancer surgery, in particular for lymph node dissection. So I've just recently had a full axillary clearance, hence I've still got the bag with me. If you have got a bag, I found it really helpful to use a bum bag just to strap it in so it's not hanging off my arm with weight. So finding something that you can do to support it, but obviously at the moment we can rest it in laps if you've got one. So finding a comfortable seat and feeling the connection of your feet on the ground. If it's comfortable for you to be barefoot, I think that's great because it helps to create sensory feedback, which is helpful. Socks, or if you're comfortable in your slippers, keep your slippers on, no biggie. Try and have a long spine so that there's a sense of length and space in your body. Space is very healing. And relaxing your arms down by your sides. If it's comfortable for you to lightly close your eyes, then please do so. Otherwise, just opening your eyes and fixing at a point slightly ahead and down. Becoming aware of your breath. So finding the equal breathing, same length inhale, same length exhale. If it's feeling right for you to bring a hand onto your heart centre, please feel free to do so. Resting the opposite hand either on your lap or maybe bringing it onto your belly if that's comfortable. Okay, if you've had surgery on one side, I suggest using the opposite hand to come onto your heart centre. If this isn't feeling comfortable, just rest your hands in your laps. And then see if you can begin to relax your bodies with your breath. So there's a sense of softness as you breathe in and out. Perhaps you can notice your body moving with your breath, maybe your belly, maybe around the ribs, the front of the body, the back of the body. If you notice your shoulders moving up when you breathe, then I invite you to relax, let go of any sense of trying. Softly, softly, less is more. I quite like to bring my mind's eye into the middle of my body and think of breathing from the inside out. It's almost like you're creating space as you breathe in. Exhaling and breathing out. If you're finding that quite challenging, you might like to bring your heart pillow onto your belly and gently draw it in. And as you breathe in, think of bringing your belly into the pillow. And then soften what you're doing. Everything's soft. Shoulders are relaxed. So just taking this moment to thank your bodies for the beautiful healing it's done so far. Acknowledging that every minute of every day the body is healing and how amazing that is. The capacity our body has to adapt and heal. And then setting an intention to introduce some movement into your day that will help your body to heal even more. So using a conscious breath is very, very healing, and also some conscious movement. So we want to get the balance right. Movement's really healthy, it's healing, it's helping to bring fresh oxygenated blood, healing properties to the area that's been removed, and it also helps to take away any byproducts that our body doesn't need anymore. And in order to do that, we need movement through our circulatory system and through our lymphatic system. So if your lymph nodes have been removed, keeping the blood flowing through the body is super important. So walking around periodically throughout the day is very helpful. Doing some wrist rolls. If you're lying in bed, stretch your legs, circle your ankles. Just keep that movement, the blood flow through your bodies, allowing the healing to take place. But of course, it's equally important to rest and nurture yourselves as well. So bringing your arms down by your sides now, and just noticing how it feels for the weight of your arms to relax by your sides. Bringing your left ear down to your left shoulder, breathing space between the shoulder and your ear on your right side. Open and close your jaw. Inhale, head up to center. Exhale, ear to right shoulder. Again, you can do these neck stretches just periodically throughout the day, releasing tension around the neck, around the jaw, and around the shoulders. Is going to feed down around your diaphragm, around your ribs, around your heart center. Making any micro movements that feel nice for you. Slowly coming back to center. Inhale as your shoulders gently move towards your ears. Start with very small movements, just starting to mobilize, warming up gently. Inhaling as the arms come up, shoulders come up. Exhaling as they gently draw down. Check you're still sitting up nice and tall, so there's a sense of the ribs lifting away from the pelvis. So there's a sense of activity through the center of your spine. And there's a sense of expansionness across your shoulders. Inhaling up. Exhaling down. So moving in a range of movement that feels right for you in this very moment in time. It might be more than the last time that you practiced. It might be less. That's okay. Be where you are. Okay. Sensation is okay. Pain at the site of your surgery is something to listen to. There's information there for you to back off slightly, reduce your range of movement. And any nerve sensations are normal when you've had lymph nodes removed. So listening in to decide if you need to back off a little bit or just use your breath to allow it to pass. So I feel like I have to move really slowly sometimes because I can feel nerve activity going on, and then come into a full, deep diaphragmatic breath to help it pass. And if that's happening every time, just reduce your range of movement. And now coming into shoulder rolls, so gently bring the shoulders forwards and up, and gently round and down. Again, start with really small circles. Inhaling with the breath as the shoulders come up and back. Exhaling as they come forwards and down. And we're moving through gently reverse, come round in the opposite direction. Bringing breath to movement again. So these movements are slow and considered. It's like you're moving with your breath, following with your body, and observing with your mind, and making your own decisions as to whether you increase your range of movement or decrease your range of movement. So bringing your hands up onto your elbows, Gently raise your points of your elbows forwards as you breathe in and down as you breathe out. Starting again with very small movements. Check that you're still lifting up. So have a sense of lifting up and starting to move a little bit from side to side through my waist. Inhaling the arms up. Exhaling down. Inhaling arms up. Exhale down. So again, linking breath to movement. Keep your awareness on your breath, and maybe you can have a sense of lightness through your bodies and your beings as you're doing this movement. Bringing in healing light to your bodies. So from there, think of bringing your shoulders and moving them away from each other. So this creates expansion across the chest. Just get used to that openness, maybe imagining a smile across your chest or beaming light, healing light. You can use your fingertips to check that the shoulders are drawing down the back. So there's as much space as you can have between your shoulders and ears. You might like to imagine a triangle of space between your shoulders and ears. And from here, simply breathe and check your shoulders aren't hunching up with your breath. This allows the rib cage to move, the diaphragm. And if your shoulders are hunching up and your hands are rising up as you breathe in, then soften what you're doing. Think of halving whatever you're doing. Just by relaxing, often that allows the breath to come lower into the body. There's 15% you can get a 15% increase in volume of oxygen if you're breathing lower down. So it's really important to tap into the lower lobes of your lungs. It will increase more efficiency with the breath and the energy it has to offer our bodies, the healing energy it has to offer our bodies. So a functional breath is so important in healing. Breathing in and out of the nose, steady, even breathing, slow, gradual. And when you're ready, bringing in the movement with the breath, so inhaling the elbows out to the side, exhaling them down. You might notice a little bit of crunching during some of these exercises. Again, that's normal, but B, it means it's good that you're doing it. So this movement practice can help to reduce adhesions, scar tissue, as well as aiding the healing itself, and help to reduce swelling, and of course increasing the circulation and lymphatic flow through the body. As you inhale this time, bring the elbows up and keep them up to wherever they're comfortable. Find that lift through your waist. So lifting the ribs slightly away from your hips. Find that sense of inner activity, but then also sense of spaciousness. So almost think of filling your spine with your breath as you breathe in and out. And there's an invitation here to add a little bit of a rotation through the ribs. Inhaling back to centre and exhaling for a little bit of rotation the opposite side. And again, one side may very well feel different to the other. You might want to make these movements tiddly-widdly, like just a millimetre each side. Or maybe you can come out a little bit further. Gently bring the elbows back, forward and back, forward. Okay, again, you might only be bringing your elbows halfway back. Just really listening in what's happening in your bodies right now, in this moment. Remember, you can rest at any time. At any time you feel like you need to rest, bring your hands down, relax, and simply be with your breath. So you're going to bring your hand again behind your back. So remember, you can bring your palm to face back with your thumb drawing down. Notice that helps internal rotation to the shoulder in preparation for the arm to come back. And again, just bringing the arm that wasn't operated on behind your back first, if you were operated on one side. If you weren't, then simply move very mindfully with your chosen side first. So what can happen is when you move your arm first that hasn't been operated on, it can help for the nervous system, when you do the opposite side, to follow, to copy. So it can help to mimic what's happening on the good side, or the side that hasn't had surgery on. So there's neural pathways here being reconnected and adapted to, and these exercises can help with that process. So gently bring that arm down and moving very mindfully on the opposite side, spinning the arm back. Remember, you might just bring the arm onto the hip to start with and just build up a little bit of trust and then how that feels. Slowly bring the hand behind, finding the flesh of your glute, then maybe you can slide it to find the elbow of your arm and hold on to the elbow. And then breathe space around the chest and the arm. If that feels comfortable, you might be able to encourage your arm up towards your shoulder blade, maybe even between your shoulder blades. Again, this is going to depend on the range of movement that was there pre-operation. Being where you are with your breath. Maybe this is a good time to thank yourselves for making time to do these exercises that will help your healing journey. You might even add on a little bit of a stretch. You can keep the arm behind the back and then you can stretch out through the neck, knowing everything's connected in your body. Gently release. Very slowly and mindfully. We don't want any rush to do anything here. Slowly and mindfully allow your arm to come back, and just take a moment to let the arm hang off of the shoulder, and take a moment to observe how you're feeling after that movement. Come back to your slow, gradual, soft yet full breath. Resting your arms on your lap. And then coming into the hands behind your head. So again, moving with awareness. If this is too much for you today, then just keep your hands onto your shoulders and bring the elbows forwards or out to the side like we've already done. But I encourage you to simply see how it feels. Bring the arms up and roll through the wrist to encourage some circulation through the body. Now I'm going to lift from my ribs here as I come up. That gives me more height in my arms without me having to move from my shoulders. So think of lifting up from your ribs, just moving a little bit from side to side. If anything feels wrong, bring the arms back down. This is really important that you're tuning into your bodies. And then bring your hands behind your head. Again, moving really slowly, interlace your fingers, elbows are pointing forward. And there's a lift up through the spine. There's a softening down of the shoulders. And just first of all, take a moment to allow your body to respond to this position that you're in. And then gently inhale as the arm opens out to the side, noticing differences from one side to the other. So I find this is a position that I can get the nerve response coming down the back of my arm and into the under the arm. So just not moving really slowly. Filling space with breath. And gently coming back to centre. So moving mindfully on the way in and on the way out. Often we pay more attention on the first movement. So move with keeping your awareness and your intention as the elbows draw in as well as when they draw out. Softening the shoulders down the back. Find your breath with the elbows open and that upward lift from the front of the body. And then exhaling and drawing in. So you might even add on the little curl shape that we made before drawing in, exhaling, stretching through the spine at the back as you draw the front body into the back body. Inhaling, lengthening, opening, moving really slowly and mindfully. Exhaling as the elbows draw in. And last time, inhaling and opening, so you can do that with your arms on your lap if it feels too much to have them behind the head. Again, bringing the arms down, really slowly allowing your body to adapt to the movement, resting your palms facing up on your lap. Coming back to your breath. Just remember you can do it's like a seated cat-cow with the hands on the lap if you find it too much with the hands interlaced behind your backs. This would be your alternative. Exhaling as you roll back and inhaling as you find some lift and lengthen through your spines. And then sitting nice and tall, imagining a ball of bright white light above the crown of your head. And imagine that you're lifting up towards the ball of bright white light. Lightly closing your eyes if it's comfortable, finding some softness around your forehead, eyes, eye sockets, cheeks, jaw. Opening and closing the jaw if that feels nice. Bringing your awareness back to your breath, allowing it to be soft, slow, gradual and natural. Breathing in and out of the nose. And then keeping your mind's eye on the bright white light above the crown of your head. Visualize the light coming down through your crown of your head, through your skull, throat, chest, heart center, belly, abdomen, pelvis. Inhaling that light down into your bodies and into your beings. Exhaling and releasing anything that no longer serves you. So with every in-breath, bringing more light into your bodies. Filling your spines with light. Your cavities with light. So your skull, chest, abdomen and pelvis. Now breathing that light from your abdomen, from your pelvis, from your chest, to your arms and your legs, to your limbs. So inhaling the breath, the light, into your limbs. And exhaling it back to your body. So your entire body now is filled with light, healing energy. Breathing that light from your centre of your beings to your limbs, up from your chest, through your shoulders, armpits, down to your hands, down from your pelvis, through your hips, to your legs and to your feet. Allowing your entire bodies to heal. Your some 15 trillion cells. Visualize them all dancing in this light, surrounding all the cells in your body with healing energy. Visualizing happy cells. Healthy cells. And bringing your awareness to your heart center. And if it feels right for you to bring a hand onto your heart and a hand onto your belly, please feel free to do so. Almost foster a sense of coming home. Be quite nurturing, very healing. Hands on touch. Bringing your awareness to your heart centers. And then taking that healing light from your heart to the area of your surgery. You're just repeating a very simple mantra. My body is amazing. My body is amazing. My body is amazing. Bringing your awareness back to your heart center. Invitation to bring your hands into prayer, resting with your thumbs on your breastbone. I trust in the process of life to bring me my highest good. Sending all of my healing light and energy from the depth of my being to the depth of yours. Namaste.